welcome. This is Corey Cooley here with What's Up Woodford, also chairperson for the Woodford County Chamber of Commerce. Super excited. We've been talking about this for a little bit. Obviously, as you know, you're listening. We do podcasts, and we have a brand new one for you all today. And there's no lack of information here. We have two professionals sitting in front of me right now. Miss Allie. And Allie, what your last name again?
Wood.
Wood.
Yeah.
Allie
Yeah.
Wood. See, I'm a great host, right? Miss Allie Wood and Mr. Dr. Graebe is sitting in front of me. I'll let them introduce themselves and talk a little bit about what they do. But this show is called Optimized Performance with Dr. Graebe, and I'm hosting this to kind of get things moving. It's the Neurovisual Performance Institute is what they do, and is who they're with there. And I think this episode, I'll go ahead and start right into it real quick with the description. This introductory episode is for moms, athletes, and families who know something is off with focus, learning, behavior, or performance, but haven't gotten the answers that exactly fit. Dr. Graebe explains how a lack of key visual skills can quietly masquerade as ADHD, dyslexia, anxiety, poor sports performance, and just not trying hard enough, even when standard eye exams say everything looks normal. You'll get a simple, clear picture of what the visual system really does, who we can help, and how changing these skills can create permanent improvements in performance in almost every area of life, at school, at home, and on the field. Wow, that is awesome stuff. I'm going to go ahead and pass it on to Miss Allie. Miss Allie, explain a little bit about who you are before we get to the headliner here.
Yeah.
If you imagine a curtain.
The opening act.
We're on Jimmy Fallon. That was a terrible Jimmy Fallon impression. But Miss Allie, please tell me a little about yourself and what we're looking at here.
Yeah, so my name is Allie. I've been with the company for about 8 years.
Wow.
I've done just about everything from the admin stuff to management to marketing and just all the things.
Jack of all
I've
trades.
been with Dr. Graebe for about 28 years. I'm his daughter as well.
Okay.
So, but yes, no, I've grown up seeing vision therapy and I never fully appreciated it until I started working there. So it's been really cool the last almost decade being there and seeing all the different people that we can help and the people he's been helping for the last 35 years or so. It's pretty neat.
That's incredible. Doctor.
Yeah, I'm Rick Graebe. I'm a neurooptometrist, and I've been practicing in Woodford County since 1984. But it was in 1990 is when I, really started doing vision therapy. Then we've kind of taken that to the next level of neurovisual performance with that too. It's just smart people who shared ideas with me, and we just keep adding things as all this new brain research is coming out. And
Sure.
The biggest problem for us is we really don't have what I call an elevator talk. We can't explain this, so I'll pre-apologize. There's a lot of talking, a lot of things.
That's what this is for,
Okay, well,
absolutely.
Yeah, I always think a good place to start is just to kind of have a better understanding. Kind of first, like I said, my story is that my first 6 years of practice, I thought vision therapy was voodoo and quackery, and I wanted no part of it. And now what we've done is we've created the only practice that's ever in the state of Kentucky that's ever been vision therapy only. So that's what we do. And with our clinic, all these proprietary programs we have, our average patient in 30 weeks will have over a 3.5-year jump on their skill levels. And it's making permanent changes in their brain, creating new pathways that basically will stay with them forever. So over 90% of our patients we never need to see again.
I'm visualizing literal how they say wrinkles in your brain, but the neurons connecting and getting stronger.
That's exactly what's happening, because that's how you learn to walk, talk, ride a bike, and I'll get into kind of how what we do relates to all that with some examples that hopefully will simplify and make in a way that makes it easier to understand. But just the complexity of the visual system itself is there's 1.9 million fibers coming out of each eye. 70 to 90% of the pathways in the brain are involved in vision, directly or indirectly, and yet we're still putting a chart on the wall that came around in 1840s, and that's what we're doing. We'll do tests that nobody else in the state's doing. We can say, read a paragraph. When you're done reading, it'll show in real time how the right eye's moving, left eye's moving, how well you're tracking.
Yeah.
we check everywhere you could possibly look. Are your eyes working as a team, not working as a team? So we can measure balance. You can stand on a board and it will measure within centimeters how much sway you have. And we can say, is that problem from a vestibular problem, a proprioceptive problem, or from a visual problem? There's just so many different areas that we work on, but it all kind of starts with vision should really be 4 parts. And I'm like every other eye doctor in school, we're taught, do you need glasses to see, and are your eyes healthy? And that's the basis of an eye exam, which is very important. And I never want to but that should be the beginning,
That's
not the
first
end.
steps, right?
100%, 100%. But then there's 3 other steps. Once you get a clear image, your brain has to process what you're seeing. There's actually 2 processing paths in the brain, which I'll get into that. But anyway, so you have to get a clear image, process what you're seeing. You have to integrate your vision information with your other sensory information and make sure they align with each other. So get a clear image, process, integrate, and then you have to act. So if you want to think in real simple terms, I said vision, my definition is you have to derive meaning and direct action, or you can think about recognize and respond. And we have programs that can improve the speed and accuracy which you recognize and improve the speed and accuracy which you respond. And like I said, so we work with virtually anybody from special needs to pro athletes and anybody in between. My 2, what really got me into this, or where my heartstrings really are these bright kids are having difficulty showing the rest of the world how bright they are. But a lot of times they're having trouble. Visual processing is probably the biggest area that we see difficulties in. But for instance, light hits your retina, and then your brain processes. Ambient processing takes 1/10 of a second. And there's a second pathway called focal processing, and that's what eye doctors are trained in, focal processing. You go to the eye doctor, you look at these little holes with a closed machine in front.
I just did that not too long ago, actually. It's
So
wild. I saw the inside of my eyeball, which is bizarre.
Critically important. I mean, that's the only place you can see artery, vein, and nerve without cutting on the body. So there's over 200 body conditions can show up in there. So it's just such a great thing to give your general health, and so many precursors like seeing things like diabetes, high blood pressure, things like that before they actually are problems for you. So it's just such an important thing for those parts. So the structural part of an eye exam is critically important. I don't do any of that anymore because that's what every eye doctor is trained to do. And right now there's 2 of us in Kentucky are board certified in neuro rehab and vision development. And so I've focused more on that. So because there's just not so many hours in the day. So I said it makes more sense to focus on that. So it is an instance, but back to you get a clear image and you process. So your ambient processing and focal processing. So I always use an example when patients have just driven to my office. I said, driving over here, you basically, light hits your retina, and in 1/10 of a second, your ambient vision is going to tell you there's 6 cars in front of you, 3 are parked, 2 are going your direction, 1's coming from a side street. And it will tell your focal vision, I need you to watch the side street. So if I said, what did you see? You would say, I see a red truck coming from the side street.
Right.
But hitting your eyes were the other 5 cars and the road and the trees
just
and
going
clouds.
straight to the brain.
Yes, and the ambient is saying, what do we need to filter out? That's the same thing when you're looking at a page full of letters. What do you filter out and what do you pay attention to?
That's so interesting.
And the other part, just the mechanics, the turning and pointing. The read a book, the part of your eye that can see 20/20 is the macula. It's about the size of a ballpoint pen opening. So everywhere we look, we're turning right, left, up, down. It's like taking 2 laser pointers and keeping them aligned as you move around. But
I can't imagine trying to do that.
No, your hands aren't close. The highest ratio, like neurons to muscle cells, is on our fingers and neck as far as skeletal. 1 neuron controls about 200 muscle cells. They discovered about 8 or 9 years ago, 1 neuron controls 1 muscle cell in the eye, and that has a feedback to say, how are we doing? And that's why we can do that without even thought. But we had to learn. It takes us till mid-teens to learn these adult-level visual skills.
I mean, it's so acute. I mean, it's so, like, microscopic. I mean, it's so little. Like, I don't know what other words I could use for little, like that. It's little quick things, and you think about that every day.
We take it for granted.
Like
that, yes.
Or you don't think
a lot
about
of times
it
it develops, the way it should, and then when we see these kids and they have these visual deficiencies or these people recovering from brain injury, these things suddenly are not automatic anymore.
But even and correct if I'm wrong here, but I'm also like, you could have none of these. You could just be you, and you didn't have any of these injuries, and have no idea.
And that's the development, like up until age 15 or whatever. It just may not have. You may not have gotten what you needed developmentally.
And through
get
no
there.
fault. I mean, just through
Yeah.
just
No, I tell
life.
people it's like trying to learn to play
Yeah.
piano when the keyboard's turned off. You're just not getting
Yeah.
enough information.
Step one,
Feedback.
plug the keyboard.
Yeah,
Yeah.
and
Yeah.
exactly. And I
Yeah.
tell people that's really what we do is we turn the keyboard on, we plug it
Cool,
in.
man.
Because at the end of the day, the magic, we are just coaches and facilitators. The magic in all this is patient's brain.
Oh,
We're just
yeah.
giving the brain the information it needs. And I always use a simple concept called brain dimes. I said everybody's
Okay.
brain will have limited resources. So I said you have $1, we all have $1 worth of dimes to spend, and that's it. So at birth, the only sensory system that's fully functioning is our vestibular in our inner ear. So when a baby cries, what do? We rock it, we
Right.
swing, we stimulate vestibular, and it calms the baby. But the rest of the brain is basically just open pathways at that time.
Oh, just
Little simplified,
sponge.
but not much, exactly. And the brain is still developing till mid-20s.
Right.
Your visual skills are developing till mid-teens to get adult level. So what happens is, as you're think about, we have these limited resources. So as you're learning, we don't know how to use our arms, legs, hands, or our visual system. And so what happens? These kids are learning to walk, and they go, "This walking is cool, but it's taking 60 cents of my brain dollar."
got it.
But they go, "But this is cool," so they
Yeah,
do it.
I like this.
And their
I wanna
brain,
keep doing this.
We're good, and yeah, exactly. And the brain is going, "I love the walking, but I can't keep spending 60 cents every time I want to walk across the room." So Hebb's law says nerves that fire together will wire together.
Okay.
The reason being, the brain is saying, "I have to conserve energy, so I need to create a pathway for this, so I don't have to spend any dimes when I do it."
So what are we noticing, Doctor? When are they crawling, or are they just not move? Like
That can be, and that's a good. I'm glad you brought that up because
Like a reason for the lack of those
yeah,
skills
like
developing.
yeah, like
Yeah.
what? Like if you're because in my mind I'm thinking, okay, if I've got to do this is exhaust. I want to get over there,
Right.
but I can't. I want to do something else. And
Well, we learn all these all these neurovisual pathways develop through movement. And one of the big problems is screens these days. That's a whole. That's a topic for
okay.
And even the last 20 years, a 30% jump in kids becoming nearsighted. No question, it's because of screens.
sure.
This stress up close is hard to do.
And it's not just iPad. Like it's schools.
Right, you're forced
I mean,
to.
you
You don't have
are
a choice.
there. Yeah, job, work. I
Yeah.
mean, it's
Yeah,
our
so
People
lives.
aren't getting outside the way that they used
Yeah,
to. Like
sure.
the blur on the peripheral
Yeah.
is what, like, he can
Yeah.
explain it better, but just like slows that progression of
Got it.
nearsightedness.
Yeah, so basically, if one parent's nearsighted, you're 40% more likely to be nearsighted. Two parents, you're 60%. So there's a genetic component to this.
Sure.
But there's epigenetics. So kids who will spend time outdoors on a regular basis are as much as 45% less likely to develop nearsightedness. And what Allie was saying is that peripheral blur that creates that. And so when you step outdoors, you're getting full spectrum sunlight instead of artificial light, for one. And then two, there may be a tree far to the right and a barn off too far to the
You're
left,
not
and they're
even-
far enough away, they're
yeah.
blurred. So you have peripheral blur on your retina. And this whole concept of, sorry about your luck, you're stuck being nearsighted. My personal story, I was nearsighted from age 17 till 61, and I did light therapy, which is probably a whole nother topic in and of itself. But,
Sure, yeah.
But I'm not nearsighted anymore. I don't need glasses at all.
yeah, that's
And
wild.
So it's just, and all I tell that story just to say what we're taught in school should be thought of as truth, little t, not capital T, not the absolute truth. There's other. I always love one of my mentors. His quote was like, "There's many paths up the mountain, but they all lead to the top."
Yeah.
And that's kind of what. Does somebody want to take the effort and kind of work on getting that? You can't promise it will work because there's genetic factors involved.
In the military, we had adapt and overcome.
Right.
Well, and back to like just the early childhood things, a lot of times we'll see kids that like we'll ask how their birth went, for example, because like going through the actual birth canal has its benefits later down the road. Like when you talk about primitive reflexes and things, like he was saying kids need to move. You're working on those reflexes because those big muscles like have to work before the smaller ones in the eye can work and function accurately. Like we'll ask patients a lot of times, like they'll score a certain way on a certain test that we give them, and I'll look at the parent and I'll say, did they ever crawl? Like, or did they just go straight to walking? And they're like, they never crawled. Like that's the importance of like these developmental milestones.
We have tests for that to check primitive reflexes as well. And if we look for that, that's why we say we're head to toe. We look, it's a whole body, because basically as adults, our body supports our head supports our eyes, and then our eyes tell us about the world out there. And you can't make an eye movement without sending a message to your body. You can't make a body move without sending a message to your vision system.
Man.
And that's that ambient vision system I'm talking about that we don't know. The word means in the background. So we don't have any conscious awareness. And kind of going back to reading, everywhere we look, and our eyes will move right, move left in the distance. But then we start doing this close work, our eyes have to converge and turn in. And so to read a book, you have to turn both eyes in at that laser pointer macula specificity, whatever, with that accuracy. And then you have to focus with your lens to take your distance vision up close as you're keeping your eyes together. Then you have to move your eyes across the page. You then have to phonetically decode the words. You say the words out loud in your head. You process them auditorily. Then you turn it into a picture. And when all that happens without brain dimes, you go, oh, yeah, this is like a movie in my head. But we have kids who have troubles. They have trouble with just the visual efficiency, the mechanics of pointing, moving, tracking their eyes, and we test to see, is that a problem? They may have trouble with the cognitive part from visual efficiency, visualization, visual memory, all these different tests, or they may have a problem with sensory integration. So we look at all the pieces to the puzzle to see, and when you look at all of them, that's why our results are so much faster than other clinics for that.
Just you saying that out loud, all those things that you do. Like I've never had someone explain to me.
That's what I was going to say.
Yeah,
like,
okay.
Yeah, like you're throwing out all these terms, but how does that, like, how would that resonate with, like, moms who, they just know their kids are struggling with reading?
Read,
like,
just
how,
read.
How
It's
would
like,
that
there's
show
a lot
up?
more going into it than
like,
just
how would that
read.
show up in everyday life? Like, at school, at home, and even for brain injury
It's no
patients?
different. It's no different. I use the example all the time. It's like trying to run with heavy shoes. And the coach, everybody says, run faster, run harder. And these kids are trying.
Yeah.
And eventually they're going to hit, they're in, and they go, I'm just going to wave the white flag. This is too hard. I'm trying. Nobody's giving me credit for trying. And you usually see this in, like, when you're going from learning to read to reading to learn. So about third or fourth grade,
Learning to read, reading to learn.
these good students start going, I'm struggling, because before they could just sit and listen. The class is reading it out loud as a group. They could do those kind of things.
Right.
But back to what you were saying, Allie, the moms will just notice it's what we call homework wars primarily. What should be a 20-minute assignment turns into a 2-hour battle.
Sure.
You know, so, and what
And we can have a whole episode on that later.
I mean, I feel like we could break down each thing an eyeball does when you read each episode. That's incredible.
Well, it is. So what happens, though, is these kids, they usually just say, reading's just not my thing, or I'm just not good at school. But I said, if you always want to look at 3 to 4 why questions to get to the root cause. If a kid tells me, I don't like soccer, I want to go, why? And they go, because I'm afraid the ball's going to hit me in the head. Why? I can't really tell where it is. Why? My vision's not giving me the right information. I go, that's the root cause. Deal with that. And so we have these kids who often get labeled ADHD, dyslexia. If you look at, and these are real legitimate diagnoses, so don't read anything in.
Oh, sure. And it could be the case, but you're doing your due diligence to make sure it's not,
At any point in time, we have a dozen people in our program who've been labeled dyslexia, labeled ADHD, and afterwards they don't have reading problems, they don't have
probably on
problems.
medication, that could also, that you don't need to necessarily need to be on.
A lot of parents we see, like, the goal is to potentially get their children off certain medication if they can. Like, if they can function without it, that would be the end goal as a parent.
Yeah, there's so many things like those conditions, sensory process disorder. We basically, I love and hate this concept says labels are for cans, not for kids. But it's just an instance when you look
a lot of great one-liners.
We have to get a diagnosis in order to in healthcare, in order to charge a fee for anything. So we have to stick a diagnosis on everybody. So does the school.
Well,
they have
same
to
like
put
the
a
school
diagnosis.
system to give the kids help.
So
in
what
school.
happens?
Yeah.
I said, think of those if those were running problems instead of reading or learning problems. So you're a dyslexic runner, you're an ADHD runner, and we do our test. And our tests discover you don't have the skills you need. So it's like we've discovered you're running in 30-pound shoes, and we have programs to lighten the shoes. So I don't want someone to say, you're a dyslexic runner. Let us lighten your shoes first. Then let's see if you're still a dyslexic runner. And virtually all of our patients afterwards, if we see they have deficits in these areas, I don't know of anything out there that can make these changes as quickly as what we're doing. I hope there's something faster than better than what we do.
I don't know if he said this yet, but it's like over 70 to 80% of what we process goes through the visual system. And so a lot of times when I talk with parents or meet with patients, I say, like, we don't necessarily treat or cure anxiety, ADHD, dyslexia, all the things, but what we can do is address your visual deficiencies that might be contributing to those behaviors.
Right.
So that's like what I tell them. And a lot of times, like he said, when we address the visual deficiencies, again, like that's that bottleneck for them where it's like everything starts in the vision. And vast majority of what we collect is through the visual system. So if that's the
It could go against everything that they've been hearing for years too,
Yeah.
and them having to almost rewire but I've been told this and this and this.
Well, it's a
like,
reframing of how you think,
It's
for
right.
sure.
paradigm
Yeah.
shift, big
Yeah.
time. And it is
Yeah.
even like
being
you
open
said,
to that.
70%, but school is more like 85% of what we do. And if you look at general population, say, let's check just your eye movement, how precise you are. 25% of the general population will not have adequate control of their eyes to really maximize their performance. You look at populations who are known to be poor readers, it's 75%. And kind of the sad statistic, if you look at juvenile delinquent and prison populations, it's 90%.
Right.
So there's just so much there's so much you can end up doing. Vision's just pervasive in so many different things that we're doing with this too. And so back to the heavy shoe analogy for school, what the school system does is they're going to say, you're falling behind in the race, get in our golf cart. Here's your IEP, here's your 504 plan, here's your special assistance and whatnot. So they get you from K through 12, but you still have heavy shoes.
Right.
And then you're very limited on what job opportunities or where you're going to go with that. And so what we do is we make the shoes lighter. And so I'm not knocking get in a golf cart, because I don't have a golf cart. I don't know how to teach reading, writing, arithmetic. But the cool part is if you give teachers a kid with good visual skills, they can teach that child. Because it's so hard for teachers in their class. In Classroom USA, a third of the kids it's too fast for them. A third of the kids good pace, and third are bored. It's
We could just clone you and put you in every school, you know. I mean, like that's just not feasible.
Well, here's it's interesting. I just had a conversation with one of the Senate minority leaders about getting in school systems. We had a school system up in Cincinnati wants us to put our programs in there. So we're developing programs that could go in schools. It's just working out all the details.
And that takes we're
also doing programs to teach other doctors how to do what we do too. That's another big push that I have
You were
right
mentioning
now.
that early before the show.
Yeah.
I mean that the fact that there's only two, and when you said that at the beginning, it's like, that's crazy. But then as you're explaining more and more about what this is, it's even more crazier that there's only two. Like, like it makes that number that much smaller.
Yeah.
But the problem is it's the school systems now, all the new research. When I started doing this in 1990, there was not near the brain research supporting what we do. Now all the new research supports what we're doing. But the optometry schools have a dilemma now. They go, we already have a full curriculum. How can we add this to it? So it's another year of training. If they did that, and it's another year of tuition. And so,
Well, I think a lot of it too is
for sure.
like public education and awareness. Like a lot of people don't even realize this is an option for them. Like everybody's heard about physical therapy, occupational therapy, and they send their child or themselves there no problem because they know exactly what to expect.
Right, it's been done forever. That's kind of I know someone who's done it. I know 2 or 3 people who's done that.
And there's a
I guess
level
I
of
need to
like
do that.
skepticism, when it comes to this too, among doctors and patients, just because it's not totally mainstream yet.
Right.
Even though like we have great proof of concept because we've helped
got the
over
data.
9,000 patients over the last 35 years improve their skill level by like 3 years jump just in 30 weeks. And so that's the thing too, like when you were talking about, I forget what we were talking about, but it made me think of somebody that was like skeptical or scared to start. Like we have success story after success story where it's like on video they're saying,
I was just gonna
at
ask
first I didn't really know about you guys, but now like I'm a firm believer. Like we had one guy go through like one of our 12-day intensive programs, and he was actually, when he went through it, he was experiencing double vision all the time, like for years, and like nothing would get rid of it except for prism glasses, but he was bound to those at that point.
And he had to keep changing prism glasses because that keeps fluctuating.
Yes. And so he did this 12-day program, and like I think halfway through, like he started seeing single again, and then like by day 12, like he was seeing single, and granted he still needs the help of vision therapy to understand what to do with that, but he was actually scheduled for a surgery on day 12.
Oh.
And he canceled that surgery because he no longer needed it.
It's like, it's almost like how you described the eye, and how it sees. And there are certain things that just, all these things happen. It's like, it's the same thing. It's like you're just kind of almost blinded to the fact that this is an option. And I agree with you. I mean, education, I'm thinking, do I need to,
It could
there's things that
benefit anybody.
Yeah.
And I know that's what our big push is now. Like I've made so many YouTube videos that I'm going just all about education.
Yeah.
You see the magazine we have here that is available.
Awesome magazine.
That's also available digitally now. And Allie knows more how to reach, like how someone could say, how can I find some of these videos that give you more information, or what do we do? And we're revamping our website to make it more. We're putting a big push to just educate, where we've never done that until 6 months ago. It's just been word of mouth kept us busy with that. Until then,
that's a huge stride, and I'll tell you what, we'll have that linked in this podcast,
Cool.
In the description there, website, and definitely that YouTube channel. You know, I don't know, this may sound, I'm a visual learner, you know, and
70 to 80%.
See, yeah, there you go. I fit right in there perfectly. I just like to see it, and it's easy for me to see it drawn out. And so, you know, I'm also a big paper guy. You know, I'll print it out and I'll make notes, and it's hard for me to, you know, I was a physical calendar guy too for a long time, and that was working well.
It's hard to make the switch.
It's hard to make. I still struggle with it. I was unfortunately a little late to this podcast. So you know, I appreciate you all for being patient with me, but I appreciate you all for just sharing all this. I mean, I know there's so much more. I mean, just with the fact that, you know, people can see it in so many different ways, in so many different aspects, sports, school, just at the house. I'm hoping, you know, I mean, I'll be 100% sure you guys will get like, hey, you know, some inquiries. And I love the fact that you mentioned that the first step is that eye exam. I mean, you're not knocking that, you're not knocking schools. It's just that you are so specialized in this, and you guys see it. And how cool is the stories, the testimonies. Just be able to see that literal swing in the pendulum. Like, I don't know about this too. I got to tell everybody about this.
Oh yeah,
it's
cool.
It's just incredible.
I mean, stuff we have happening. I never would have thought when I was in optometry school and graduate. I never thought we would have had patients come in on walkers and they leave with nothing. They don't need cane or anything. I never would have thought that would have been a part of the field of optometry. We at least once a month have patients going, my anxiety's gone. You know, I never would have thought we'd be working in those field, you know, working on, you know, like Allie said, talking about, you know, the double vision. I go, we always thought we can I knew we could kind of train those sorts of
Like
things.
in 12 days. Like that typically takes a year.
Or two. Or two.
Yeah. Like, I mean.
Or surgery. I mean,
yes.
you know, and the fact that he canceled that, and like, I mean, imagine. I mean,
he signed up for the program while skeptical, in faith, and, you know.
Why not?
And he canceled that surgery.
And the cool part is, like I said, once his brain figures out, this is a better way to go. And that's what I love about neuroplasticity. It doesn't matter whether you're 8 or 98, your brain can rewire itself.
Mind you, this was like a 60-something-year-old.
Oh my goodness.
This was not a child.
And a very highly productive 60-plus-year-old who had a high-performance position and things like that too. But it is, and it's what I don't like about neuroplasticity, what you talked about earlier. We take these things for granted, but so many of our young patients, when they're creating these pathways, they create what I call the country road method. Things are nice and slow. It's like, hey, this is cool, this is fine. But then, now I have to read books, I have to catch balls, I have to drive cars, I have to play sports, whatever. And they go, I don't have the system for that. So they have to develop that superhighway method. Right. If they would have developed that initially, they would have said, bring it on, I can handle all this.
You're not a magic wand, you know. There is some work that sounds like it goes into this, some dedication.
That's so funny. A lot of times he says, I wish I could just wave a magic wand and say, oh, you're better.
I always quote everybody, a Vince Lombardi quote, I'd say, the only place success will come before work is in the dictionary. I said, but that's awesome. I tell patients, your brain, when you bring a kid home from the hospital, I can tell you 99% certainty that kid will learn to walk and talk because his brain is going to go, that's going to be helpful. I can tell you the same thing about our program. If you'll follow the process and trust the process, I'm 99% certain. I almost want to say 100, but I
0.9.
You can't. Yeah, exactly. So let's say 99% say you will be able to do this and this if we. After we do our assessment, said, this is totally, we can tell you this is totally fixable with that too.
And like, to keep it simple, it's like, if you show up to your appointments and if you do the work at home,
20 minutes a day,
you will see progress. You will see improvement. To what degree? Like, depends on how hard you're willing to work, you know? So
there's kind of a magic formula. If you go more than 3 days without practicing, the brain is not going to make a pathway in that.
Okay.
So that's why we have these protocols on exactly what you do, when you do it, how long you do it. We send everybody home with equipment, instructions, everything they need to do. And so they come in once a week, and then let's say they come in on Monday. Well, the next Monday they're working at a higher level, so we change their home activities, and they just keep stair-stepping up. And any therapy program done anywhere should have 3 components: OT, PT, speech. It doesn't matter. The first third, you're seeing what clicks for that patient. The middle third, you're really fixing things. Numbers are better, scores are better. And unfortunately, so many therapy programs go, hey, you have good scores, you graduate.
Yeah.
But if you miss the final third, you have to keep going back. And you're just like, it's still not carrying over in the real world. And that's where you get it embedded.
Yeah.
That's where you get the skill no longer takes any brain dimes. So you can just sit here and go, I just use my skill that I have, and I can now apply it. And I use example, a young kid learning to walk across the carpet doesn't mean he's ready to hike Red River Gorge. So, but when you improve that enough, where my walking is so autopilot, yes, I can now walk
autopilot
anywhere. And that's what you call muscle memory, autopilot, pathways, whatever you want to call it. But it's really, that's how we develop mastery on anything. We go through these 4 stages. We start off, we're unconsciously unskilled. We don't even know. Then we try something, we go, I'm not very good at this. You become conscious of where you're unskilled. Then with feedback, you go, oh, now I'm consciously skilled, but I'm using my brain dimes. To finally, you're unconsciously skilled. And the reason we go through that is we can do 1, maybe 2 things at a time consciously.
Right.
So think about driving. I guarantee driving here today, you didn't even
Just
remember
about to
half the trip.
yeah.
Oh, I was.
And it's
I don't want to say I was speeding.
Well, it's
but,
always because something's on your mind. In your case, I got to get there,
Yeah.
whatever. That's it.
Constantly,
So many times you arrive to a place, you're like, how did I get here?
Yeah.
Because your conscious mind can only handle 1, maybe 2 things at a time. Your subconscious can handle multiple. So these things you're doing on a regular basis with proper feedback, learning how to do that, your brain is going to say, I'm going to put that into subconscious and put it on autopilot. And so it does. And that's kind of that's really how OT, PT, speech, vision, I don't care what therapy you're talking about, that's the overriding 10,000-foot view of what's going on.
You mentioned therapy to that word. It's a lot of this stuff is going on in our own heads. And then I'm sure there are times when you're talking to people and they're like, oh, wait, like that makes sense. Like I've always wondered that. And to hear someone else, to hear you say that, it's like, oh my gosh, like I don't feel alone.
Well, and a lot of times we're that validation for people because, like nothing against general optometry. They're trained very well in what they do. But a lot of times, like circling back to the beginning of the conversation, moms or brain injury patients will go to these general eye exams and they're told, oh, you're 20/20, everything's good.
Right.
And then, but in their gut, it's like, but I know something's not right.
Yeah, right.
And that's typically when they try to find us. That's why we're trying to educate optometrists and teachers and things to know what they're looking for in terms of these skills so that more people can get help.
Yeah. And it's nothing to come see. I mean, to come see you all, I mean, it's just why not? I mean, if anything, for a checkbox just to make sure everything's good to go. And, and I mean, it sounds like you guys are the place to go. And I want to say, we're not only going to link this stuff, but where I want to talk about a little bit, like, while we'll say we've talked about, where you see it, the people, we're targeting people, moms, athletes, families who know something's off, what it could be, what it looks like. When you come in, your process, your 4-step process on how to, the therapy side of things, mechanically, how it works inside you. And it's a lot. But that's why we love this. We got this podcast now. We're going to break these things down and obviously go back and watch those YouTube videos. But where can we find you? Where are you guys? I mean, obviously you're in Versailles, but
we're 105 Crossfield Drive.
Yep.
So if you know where the 7 Brew is or the Me Pubs, like we are just right there, right across from I think it's the Holiday Inn, right across from that hotel there.
Yeah, absolutely.
Yeah. So that's where we are. We're in the same building as a Pearl Vision. So you might see their sign first, but we're also in the same building.
In the same building. And so,
And phone number.
Yeah, phone number. And
so our phone number is 859-879-0089. And you can also look at our website. It's nvpinstitute.com. And that's also got links to our socials and things there as well. Beautiful. I would guide people to YouTube if they are really interested in more information on specific topics, like bite-sized pieces, like 2 to 3 minute on topics pertinent to them. And success stories, they're all there on YouTube.
That's great. I was going to ask you that too. I mean, I'd love to see that. That's, I mean, just from me coming from a side of knowing nothing. I mean, you're mentioning things like that, like I'll walk into a room and sit, but I have a thing. I don't know if it's the military mindset or what, but I have to, my back, I have to see the exit. I have to see the windows. Who's wearing a hat? Who's wearing a hood? This guy's looking weird. This guy, sometimes it's a little too much. But, and it's another funny thing you mentioned is the country road effect. I mean, you're so used to one way and doing things, and you make your own. It's like, okay, well, if I move this slow, if I do this, I can do this, and you don't even think about it in your head like that. Wait a second, this person does this, they must just be, smarter than me or something.
Yeah.
But really it all starts being born, which is incredible.
Well, and truly the one thing we can't necessarily measure, but that is probably measured best in the success stories on our YouTube, is the confidence difference.
Yeah,
and people that like, they come in and they just are defeated, and then they come out and they're just so confident, so able, so ready to take on the world. I know there was one brain injury patient. When she started, she even like physically just looked one way. Yeah. And then, Dr. Graebe hands her off to her therapist, and, he saw her, I think at the end of her program, he said, "That's not the same patient." He's like, there's no way. He's like, "That's not her." Like,
that's incredible. Just
talking about Anna.
Just body,
it's just amazing what
that is
brain,
not her.
That's what the brain can do. I think there's miracles happening to this day, but the brain itself's a miracle on what you can do with that too. And it's just, if you don't look for those things, you don't know. And I said, it's like missing pieces of the puzzle. And we're going to look at all the pieces of the puzzle.
Gotta start with those corner pieces.
Yeah, and see if that piece has a problem or not. And if it does, we have protocols. Everything we test, we have protocols on how to improve. And everything we do is data driven. It's standardized tests. It's got research behind it. With that too, there's just so many different things that we offer.
I tell parents, patients all the time, like you were saying, like, it's, hardly any time, no money, hardly any time, energy, resources, things to just make that first visit with him. You get an hour, and he explains more about what we do, looks over the chart, does some functional tests to see what the vision looks like that have not been done at the general optometrist. And from there, he can determine if therapy is something that would be helpful. And even if it's not, and even if it is determined, but you still don't do it, you walk away from that visit. Like, he takes so much time to give the patients so many resources at that visit that even if they do nothing after the first visit, now they're educated, and now they kind of have a path to follow, even if it's on their own. So I'm like, it is so worth it just to come and just see if visual deficiencies are what's holding you back.
And once you know about it, it's hard to forget about. And I'm sure you've had people come in and do that, not seen them for like a month, but come out and go, I looked at this stuff, I started to notice a few things, and be able to help them. And I would say, what's your saved rounds final thoughts, but do you guys have anything else to add or anything you want to tack on there?
Nope.
I don't think
thanks
so.
for the opportunity.
Done
That's
a lot
one thing
of
I
talking. Thank you.
It's so hard for, like I said, that's just it. Most people don't even know this is an option.
Right.
And that's our big focus. I would say as also our personal ministry now is kind of saying, we need to get this word out. And I tell people, if it's your thing, great. If it's not your thing, great. I'm totally,
you're here,
because when there's a performance problem, everybody ultimately has four choices.
Right.
They can do nothing. They can change their environment. If you don't like lights and sound, keep your house dark and quiet. You can use a crutch, wear sunglasses, earbuds, keep yourself dark and quiet, or you can therapeutically fix it. Right. Not everybody wants to put the effort into that. So, but at least know here's an option. I had a lady yesterday, she's 90 years old, and I thought, oh, is she going to be interested? It's like, she's amazing. And we have had people, 91, I think, is our oldest that we've had. And she'll have a birthday, she'll be there too, but she's having constant double vision, and there's little doubt in my mind. One, she's going to do the work. So she's going to end up not having that. And I mean, this is a lady who's still traveling the world and doing, just crazy. So
that's incredible.
It's never too late to give up, and it's just an instance. Once you do, you kind of that's when you just deteriorate, because you're no longer engaging with the outside world, and your world gets more enclosed and closed and closed.
Snowballs.
That too, absolutely. So I just, like I said, I appreciate the opportunity to get the word out and just letting people know it's just. It can help virtually anybody, but it's like I always say, if you're happy, I'm happy. If you, I tell everybody I see, it's one question. It's like,
I tell my wife.
Yeah, what do you need? What do you need to do in your world?
And I bet you have a great marriage.
And if you're happy, and how's your performance match up to what you need to do? And if you're pleased with it, I go, then we don't need to do anything. I said, but a lot of times they don't know what they don't know,
right?
And they understand that, and they just, then they at least know it's like, maybe I do want to do this, because I could open it. They start seeing their full potential, instead of just accepting like mediocrity is okay.
Well, and if we can, if people listening to this have questions, or they're not ready to schedule an appointment, but they just like kind of want to investigate a little more, see, is it for me? they're more than welcome to call our office and we can answer any of their questions, or we
That's
can maybe
awesome.
even put our email, you know,
Yeah,
in
no,
the
for sure.
podcast as well. And they could just shoot us a quick email that we can, you know, say, okay, like, is it for you? Is it not for you? Like, we can kind of pre-screen them and just see if it's even a good option.
That is amazing. And
Yeah.
I implore everybody listening to, if you even have the small inkling that something like this could be going on, you know, reach out. I think that'd be great. And obviously listen to the next episode. We'll have several more, and we'll go dive deep into all these topics. But Miss Allie, thank you so much.
Thank you.
Dr. Graebe, thank you so much.
My pleasure. Thank you.
Everybody, thank you for listening. This has been Optimize Performance with Dr. Graebe. What's up, Wood?